Dr. H.R. Nagendra is the president of Vivekananda Yoga Samathana and also the counselor of Swami Vivekananda Yoga Anusandhana Samanthana University. Dr. H.R. Nagendra is widely recognized across the world as Yoga Guru. Dr. H.R. Nagendra is recipient of Yoga Shri title from the Ministry of Health and Family Welfare. He has authorized 35 books and over 100 research papers on yoga. The Government of India awarded him the fourth highest civilian honor of the Padma Shri in 2016 for his contribution to society. And today's topic of presentation is utility of yoga as an adjust therapy in management of cancer.
My dear brothers and sisters and great specialists of oncology, I bring greetings to all of you from our University S. Vyasa, Samsthan. Management of cancer through yoga is the topic which I am going to address. I don't have to explain in detail, but a brief glimpse as to how cancer is a disease where cells grow out of control and invade, erode and destroy normal tissue. They are not powerful invaders from outside, they are all born within us, we all know. So multiplication, destruction is an imbalance. Between our genes, the environment and the chance. There is an intricate balance which disturbs the balance and brings imbalance. So the abnormal genetics, genetically programmed growth or death to maintain homeostasis, health is the rate. Rates of death or growth decides if the system is healthy or not. We are all familiar with this entire process as to how it leads us to death. So immune system plays the most important role in dealing with cancer. So oncogenes, activations, radiation, mutation, viral infections all can cause, and immune response, macrophages and natural killers. Immune systems has many checkpoints that reverse the effect or prevent oncogenic activation. When the immune system is very strong, then it can deal with the cancer cells very effectively. But if the immune system gets weaker, gets imbalanced, gets into the wrong understanding, you have a problem. Imbalance of immune system occurs due to the stress. We all know the stress has an immunosuppressant factor. Particularly in yoga, we know a particular thing called as viparya. Among the 5 dimensions of mind, pramana, viparya, vikalpa, nidra, smrutayaha, viparya is the wrong knowledge. Seeing a ghost in a post, seeing a serpent in a rope, these are all the things that happen at the subtle level of the mind. And when this percolates into the immune system also can get into this distorted perspective, thinking that these cancer cells which are born in my body are my good friends. And that's a distortion that takes place. So what all we do through radiation, chemotherapy and surgery and other things will deal with the cancer, but the root cause is not removed. The root cause of viparya and the subtle stresses that happen. So that's what yoga addresses. So the common risk factors, we are all familiar, I don't have to explain. Modifiable 90%, not modified 10%. And excessive activation of oncogenes cause low immunity, stress, lifestyle, reduced NK cell counts, reduced NK cell activity. All these things cause lifestyle has the greatest influence in dealing with cancer, and lifestyle is getting distorted, and as a result the cancers are growing day by day, faster and faster, as has been beautifully brought out by our earlier speakers. So, what is that stress that we talk about, which has a immunosuppressant factor, is very well understood today, and it is essentially the speed, uncontrolled speed of the mind. Stress is uncontrolled and repetitive speed, and absence of mastery over the mind during the stress, and it percolates into uncontrolled rate of multiplication of cells. The speed at mind at the subtle level brings down and causes the challenges there. So therefore, what we are trying to look at things which are also subtle in dimension. Psychological impact of cancer is very well known. Emotions play a very vital role in deciding who we are. What we can recognize is just the tip of the iceberg that we have. It's here that we get the yoga dimension into the picture. Yoga works at all the levels, physical level, mental level, emotional level, intellectual level, and this is portrayed through the 5 layers, 5 koshas we call, Annamaya, Pranamaya, Manomaya, Vijnana, Anandamaya koshas, and the dimensions that are talked about, we have Manaprashamana Upayaha, calming down of the mind is yoga. Yoga is not merely a set of physical practices as most people think. It is to gain mastery over the mind, Chitta Vritti Nirodha, as Patanjali says. And in Bhagavad Gita, also we have the definitions. And using these dimensions, yoga works at all the levels. The goal of human life, as was also being brought about, is not merely to be disease-free, but to promote positive health and move out. And it is perfection. Ultimately, we reach the perfection state of what is called as Kaivalya of Patanjali. So it's a state of infinite freedom, happiness, knowledge and power. So Swami Vivekananda said 4 main streams of yoga, Jnana Yoga, Raj Yoga, Bhakti Yoga, Karma Yoga, are the 4 streams of yoga which have to be used to see that we have an integration of all the dimensions that we deal with. So working at the willpower level, Raj Yoga, Bhakti Yoga and other things. So understanding cancer through yoga, I put it there. At the Annamaya Kosha level, what happens? Sedentary lifestyle related to imbalance and stress physiology at the Annamaya Kosha or the physical level. Prana level, or over circulation, accrual of prana to undesired levels, localized accumulation causing localized imbalances. The breathing episodes start coming up because of the subtle changes that occur in the subtle prana that happens. Then at the mind level, mana level, stress-related imbalances, emotional, heart versus mind. And it's here the dimensions of stress comes into this, and at the mind level it starts off. And then at the Vijnanamaya Kosha level, incorrect notions, as I said, the wrong notions, misinterpreted information. And then at the Anandamaya Kosha level, we have the gross levels causing frost, reducing lucidity to Ananda. So the Ananda gets reduced and happiness goes on. Coming down, we have just temporary thrills instead of the real happiness that we all should get. So this is how yoga looks at cancer for treatment. So therefore the objective of the integrated approach of yoga therapy is, the ultimate goal is, can we say that yoga can cure cancer? True or not is the question that comes. So we all know the examples of mind over body functions, psychoneuroendocrinology, psychoneuroimmunology, psychoneurophysiology, how the psyche makes a big difference at all the levels is very well known. And the examples of mind over body structure is also well known. Psychoneuroanatomy. So it's here that the higher dimensions have to be brought forth, and Patanjali says it is through the different siddhis that people can get at the higher level, and they will be able to bring about the changes that occurs. And particularly, we can say spontaneous regression of cancer is one of the examples as to how, when you go into the higher level, subtle level of the mind called samadhi, then even the cancer can be devastated, can be normalized. This is how Patanjali brings about the whole dimension as to how even things can be normalized in the whole encounter. So Patanjali says, at the subtle level, dharana, dhyana, samadhi are the 3 levels called antaranga yoga. Dharana is focusing of the mind, dhyana is the meditation, and samadhi is a quantum jump to the higher level of the mind. And it's here that you get the higher perception. Then person doesn't stop there. After samadhi, there are higher levels of samadhi that all can be obtained by what is called as sayama. So the sayama is trayam ekatra sayamaha, that is dharana, dhyana, samadhi put together brings about the changes. Therefore, the 8 limbs that initially tells Ashtanga Yoga, Yama, Nema, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi, these are the 8 limbs he gives. That culminates in Samadhi, but that's not the end. You have to go to higher levels of Samadhi, which he describes in the 3rd chapter called Vibhuti-pada. So Patanjali gives the whole dimension as to how we can do dimensions, how people can go to dimension. Can we bring these levels of Siddhi to do that? What are all those things which you are talking about, Siddhis? Levitation, sleeping on a bed of nails, mind over matter experiment. Can we change the physics around which our mind seems non-scientific? This all appears to be a little non-scientific, but we have to unravel these mysteries to go to higher levels. So, in this dimension, the yoga can change genes, cells, DNA, everything can be changed. That's what has been talked about. So what we do, what we have been doing over the last 45 years, bringing yoga into cancer, is the integrated approach of yoga therapy, or IAYT. And in this, we work at all the levels. That is the physical level, Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, Anandamaya Kosha. And for that, we have developed a very simple technique. Even very severe cancer patients who come, they cannot even sit. They are lying down. Even such people can be taught yoga. They work at the prana level, the mind level, emotional level, intellectual level. And we have developed simple techniques and very effective techniques. At the physical level, we have got cyclic meditation. We can give very deep rest. How much of rest? 3 times more than good sleep, 6 hours. 6 hours of good sleep give you 9% reduction in metabolic rate. But if you do this 35 minutes of cyclic meditation, it gives you 32% reduction in metabolic rate. It gives very deep rest and stress is reduced, immune system blossoms, and it will be able to deal with the cancer cells effectively at the body level. Then we have got the dimensions of good diet. Diet is most important, as all of you have been emphasizing, and we give lot of emphasis on the right type of yogic diet and bringing lot of organic things called TTT. Tatatamatarkari means you have a lot of vegetables to take in plenty and do that. That is at the Annamaya Kosha level. We have the dimension of Kriya, Sukshma Vyayam, muscle loosening practices, strengthening muscles at the physical level. Then we come to the Pranamaya Kosha. There we have the Pranayama. Very, very powerful. Slowing down of the breath is the key essence of the Pranayama. When you slow down the breath, you have very deep relaxation and metabolic rate comes down and releases the stresses effectively, so that we will be able to see that we strengthen the immune system. But we also want to see that we have the higher dimension or pranic energization technique is the technique that we have developed to use the prana shakti to strengthen the immune system. Then at the Manomaya Kosha level, dharana, meditation is the key essence. We are talking about cyclic meditation. And mastery over the emotion is very important. It's here that we have a number of techniques to deal with emotions, and advanced techniques are used. Then at the Vijnanamaya Kosha level, proper counseling theory to remove that vipareya, that wrong knowledge has to be done. So therefore we work at all the levels. So when our patients come to our hospital, we don't call a hospital, we call Arogya Dham. There, from morning 5 o'clock up to night 10 o'clock, they undergo all this dimension to work at all the levels. At the Annamaya, Pranamaya, Manomaya, Vijnanamaya Kosha. And so we start doing that. At the Anandamaya Kosha, how do we do? We need first 4 layers of glass to be clean, to be able to experience the bulb glowing on the other side. Wonderful knowledge, power, freedom, everything is there. We have to clean up the thing so that it will be said. To tune to bliss all the time is the key essence of the Anandamaya Kosha. And we tune ourselves all the time to the blissful awareness and work. That is the thing at Anandamaya Kosha level. Then coming down to correct the knowledge, vipareya. Vipareya is the wrong knowledge, and it is seeing a snake in a rope or ghost in a post. Immune system thinks that my cancer cells are my good friend and allows that to happen. Can we remove this wrong notion? Get removed through counseling. Proper counseling can bring wonders. And that's what we have been seeing. People who are very, very sick and almost in the final stage of cancer, they bring about this transformation by proper counseling dimension. And Vijnanamaya Kosha therefore helps. So the persons will get into the total knowledge that I believe that the body is just a shell and the soul will come back on a new form. I have heard that death is actually a relieving experience for the individual. Rebirth is a natural phenomenon that is proven without doubt, and hence nobody actually goes away for good. But still, cry when someone dear passes away. That's the thing that happens. So, it takes a considerable amount of knowledge just to realize the extent of one's own ignorance. That's what Bhagavad Gita says. How to correct the knowledge? Give deep rest to the system, silence followed by a strong resolve, which provides ground for right knowledge or the correction of wrong notions. Techniques that are used have been brought about very effectively. The package programs have been done, all about 30 minutes of each one of them, or Vijnana Sadhana Kausala, in which we try to analyze what is happening and the law of diminishing returns and self-analysis, walking meditations, all these things are used to see that we get the result there. And Manomaya Kosha, we have to restore the balance. Uncontrolled speed of the mind has to be brought down. Prashamanopaya has to be brought forth. Therefore, information and emotion, Nama and Rupa are used. And the techniques that we have developed, advanced techniques called MSRT, MIRT, MEMT, mind sound resonance technique, mind imagery technique, mastering the emotions technique. These are all the 30 minutes practices they can do even lying down on the bed. That is Manomaya Kosha. So, mind sound resonance technique gives very deep rest with awareness, that is meditation. Then improves concentration, dharana, sound, internal message to heal and repair. The subtle vibration that get generated and get felt is going to bring about dimension. We have the very powerful mantra called Mahamrutyunjaya mantra, and that's the one that helps in developing tremendous strength and resolution to be healthy and strong emerging from silence. These are all the things that are done in mind sound resonance technique. Similarly, in the mind imagery technique, you have techniques to use the different images to bring about the dimension, size, color, contrast, shape, mastery over the imagery that can work wonders for them. And this is how the different images are brought forth and they can be dealt with effectively in mind imagery. Then we have the mind emotion management technique, mastering the emotions technique. Again, we use here the different emotions, mastery over emotions. I can bring them on and sublime my emotions. So to see that the violent emotions are changed and you get into the softer emotions, gentler emotions, all these things are brought in this dimension we do. So coming down to Pranamaya Kosha, with three types of imbalances we have. Ajiranatam, Asijiranatam, Kujiranatam. That is the dimensions which you all understand. That has to be corrected. So in case of cancer, excess in localized area, Pranamaya Kosha, Pranayama will help to bring the balance and the repair. The techniques that we use here, the special mudras. Mudras are very subtle techniques. It can be easily used by them and it brings awareness of prana. Then circulation of prana and reduce the excess of balance and deep rest is given called what is called as a pranic energization technique. This all can be worked under it. So this is the one that can bring the balance in our different chakras. Chakras are not in the physical body, they are in the subtle body, pranamaya kosha, that is brought into balance. The imbalances that are there are all brought forth in this thing. Today we have the equipment called BioWell to actually photograph the entire pranamaya kosha and see where are all the imbalances. How much is the imbalance? You can quantify the amount of imbalance at a very level. And giving special techniques of pranayama, you will be able to bring the balance. And that's how it is taken further. Ultimately, Annamaya Kosha, we have the yogic diet, sattvic diet, and Indian texts recognize not just what we eat, but how, when, why, and where. This is also very, very important. What we eat is important, but what is more important is where we do, how we eat, and everything. So, then we have various techniques of yoga practices. The key essence is relaxation, calmness, and loosen, balance, bring the balance. Samatvam yoga uchyate, as it is said in this thing. So, the adhesion which takes place, the cells grow as a benign tumor in epithelium, break through the basal lamina, invade this dimension. So overview is psycho-neuro-immuno-oncology is the key essence of the entire dimension that we do. The importance of mind on the entire dimension is. So therefore, we started taking up our CAM research almost 40 years back, and we have published large number of research papers in various dimensions. CAM uses increased from 1998 to 2005 and is further increasing very fast. So these are all the dimensions related to that. So we started our entire journey in 1986 with Kidwai Memorial Institute of Oncology, and we had some pilot studies, and before that 1986 we had 6 breast cancer cases, throat and bone cancer, and they got wonderful results. They were predicted to live for about 1 year maximum, but they lived for 15 years, 20 years with a wonderful quality of life. Therefore, we took up the pilot studies on different types of cancer, 100 of them, and Institute of Oncology, Dr. Krishna Bhargava was doing that. And then we took controlled trials, breast cancer, 3 years, then secondary effects on yoga and cancer cervix, 1992, and people started coming to our Arjyopa and started getting wonderful results. Within just 2 to 4 weeks, they were seeing that the symptom score started reducing of cancer patients. And this is how it started developing. Then we developed all these advanced techniques which I mentioned, working at the Annamaya, Pranamaya, Manomaya, Vijnananandamaya Kosham to strengthen the immune system. Once you strengthen the immune system, the cancer recedes. The residential treatment study started and 1994 to 96. Then we had the control studies started in 1999 to 2003, the effect of integrated approach of yoga therapy on breast cancer, undergoing radiation, chemotherapy and surgery. As an adjunct, we started giving them. Therefore, they started getting various good effects of this thing, and terminal cases, metastatic breast cancer, yoga and non-yoga, Bangalore Institute of Oncology, today known as the HCG, Dr. Nagendra and all these people, we joined together, Dr. Gopinath, we are all involved in this entire dimension, and then we wanted to see whether the DNA gets repaired in the whole encounter. We published a paper, studies on apoptosis. Indian Institute of Science, Bangalore and Manipur Hospital, we started working. Then yoga for breast cancer. So we had our collaboration with MD Anderson Cancer Center, NIH grant we got initially about $700,000, and we published the paper. Then we got a bigger grant of $5 million, a 3-arm trial, 660 patients, and now it is 5 years since we started, and we have just completed, and we are analyzing all the data for publication in the best journals, and that the work in MD Anderson. Examining the aspects of relaxation by yoga and other techniques for the 3-arm trial that we did there. Then research findings. So far we have published 20 research papers in even the best of things, oncology, psychosociology and cancer, psychosociological intervention, mediates cancer progression and survival, increases the lifespan in patients with metastatic CAB. These are all published there in this thing. So research findings, what are the things that we have found? Immune effects of yoga. It reduces the stress hormones, improves anti-stress hormones, then it improves immunological tolerance. Yoga and cancer improves QOL, quality of life, and less mood disturbance, self-reported appetite, well-being, sleep. And these are all the dimensions that we have found, and Dr. Raghavendra has been one of the things, Dr. Banerjee and others, and you could see at the physical level what are the things that happen, at the psychological level how it happens, at the psychosocial level how it happens, all have been studied in great detail, and this is further coming down 2009, 2010, and how the negative effects can all be changed and you get the positive thing. So we have understanding long-term psychological and molecular effects of yoga in breast cancer survivors. That's what we are doing now. What is the most important? Conventional treatment can only add years to our life, but not life to our years. So we have to see that QOL, quality of life should come. Therefore, we have to again look at the revisit the definition of WHO, which says it is not merely absence of a disease, but a state of well-being at the physical, mental, social, and the spiritual levels. That's what we have to do. So we have to evolve regular dimension, from medication to meditation, in a sense. Thank you all very much. And this is the wonderful thing given by Swami Vivekananda. Each soul is potentially divine. We have tremendous amount of capacity we have. And the goal of life is to manifest that divinity. Knowledge, power, freedom, bliss has to be brought forth. That is what you do through yoga. By controlling nature, internal and external. By work or worship, philosophy or psychic control, by one or more or all of these, and he said, be free. And that is the grand message given by Swami Vivekananda, which forms the basis of our entire yoga dimension in our university. And I invite those people who are here to please come and visit our 600-bed facility where we deal with this thing. And the time has come that we have to learn to diagnose things much earlier in cancer. Can we diagnose cancer 10 years before, 20 years before? Can we diagnose? For that you have to track the subtle changes that occur. And the pranamaya kosha, manomaya kosha, vijnanamaya kosha, if you track those things, then probably you'll be able to do that. And we know if you track the cancer 2 years, 5 years before, you'll be able to deal with it completely. So if you can deal with it much earlier, then it happens. This all knowledge base is available in yoga, which has to be unraveled and brought into the fore on the diagnosis front. On the treatment front, can we prevent cancer? That is the most important. We have been emphasizing on prevention than treatment alone. All our effort has been to find out better and better ways of treatment in terms of radiation, chemotherapy, and also surgery. But can we prevent cancer? That has been our whole emphasis, and I'm very happy that the Cancer Healing Center by Santosh have been very, very effective in this direction, and we'll be very happy to join hands with you. And we are going to have a big conference in San Francisco in August 16, 17, 18. I can send information. You are all most welcome. In San Francisco, we are going to have our international conference. Those who have come from outside, they also can come there, where we are going to have a wonderful exposition of the total integrative medical system to be brought forth. With that, I place on record grateful thanks to Dr. Gopinath and the entire team for bringing this conference here to JNU, and we are very happy that we have been able to achieve this. And thank you very much. Dhanyavad. Namaskar.